When I was the health minister, I remember that I had focused on eliminating the factors responsible for illness, encouraging the society for wellness, and making treatment of disease inclusive. There have been efforts to reduce the cost of treatment to the poor and to increase the number of doctors. After the launch of Test and Treat under NACP, we made all HIV positive persons to be put on free ART as soon as they are detected HIV positive, irrespective of the immune status. The Union Health Ministry also made it mandatory for all medical colleges to have a facility for antiretroviral therapy, that is ART centers. Most of the people living with HIV is now put on advanced free lifelong latest treatment regimen which significantly improves the quality of life. Friends, we must assure you that our government must provide access to good quality health care to every citizen of the state, and we must address the inequalities which are holding back progress in ending AIDS. As we all know, the Government of India enacted the HIV and AIDS Prevention and Control Act in 2017 to tackle the stigma and discrimination faced by the protected people defined under the Act, but still there are cases of stigma and discrimination. The Act also stipulates a grievance redressal mechanism through designated state ombudsman and complaint officers at establishments, and I'm happy to know that our state has appointed ombudsman and even many complaints officers. State Aid Control Society of the state, with their limited manpower, communities and partners, deserves a round of applause today to help us achieve what we did. I express my gratitude to all the doctors, nurses, paramedics, frontline healthcare workers, and the communities who in real sense are working hard day in and out to augment the AIDS response. The journey is still on, and we are all committed to achieve more. Let me take this opportunity in initiating some proposals here, if at all that attracts the kind attention of the forum. I propose to introduce sex and drug education from class 8 to class 12, which earlier was, but due to various reasons it has stopped now, but it is a must that introduce sex and drug education from class 8 to class 12. I also propose to give more emphasis on games and sports, because an empty mind is a devil's workshop. After sunset over here in Tripura, we don't have good clubs, we don't have pubs, we don't have good time spending mechanism in the state of Tripura, especially in the remotest tribal areas. And people, during the dark, they take the opportunity, out of frustration, they go for IDU, injectable drugs and other things. So we have to lay emphasis on games and sports, adventurous sports, so we have to promote them. I also propose, and I be the first person to initiate such the proposal that I am initiating right now, donate ₹1 lakh from each MLA and plan activities related to the disease from Vidhayak Elaka Unnayan Prakalpa, that is BUP. If there is a provision, if not, no provision, then the planning and coordination department should go for it. Then allowing the legislators to donate ₹1 lakh each to plan activities related to the disease. Social media message by all 60 MLAs, all of us, and conduction of 2 yearly testing camps by MLAs in the respective constituencies. Ambulance and bike from MLA, Vidhayak MLA Fund, Vidhayak Elaka Unnayan Prakalpa, we should provide them. And another thing, after going to the discussion by the 2 speakers, I know that is regarding consent. But in our state, the graph is, rising. There is a spot in the graph. So my opinion would be, though the Act doesn't say so, but it can always be amended, that a mandatory provision be installed. So for the patients coming to all institutions, be the primary health center, SDH, or district hospital, or in the state level hospital, wherever they are going, the first and foremost thing the doctor should prescribe is to have an HIV test done. Though the positive is now the thing is that you have to take that one. So the doctors can convince them and say, get it done with their consent. We are doing that. I think these 2 lakhs person that have been those data which we have been reflected over here speaks volume that screening is not being done. There will be many thousands of more people who I don't know, you don't know, because you cannot identify them merely through their to the eyes. So you have to go for blood testing. And if we achieve out of 40 lakhs of people, if this thing is only 2 lakhs and our target is 4 lakhs, I think this will not speak well of. So we have to provide. People turn up to the doctors. People turn up before all these institutions, be it for the primary health center to the state level. So there has to be a provision where we can get the blood checkup. And 20% dropping out, as was stated by Madam, the treatment.